I frequently get asked, what is the best medication, right? Best medication for my son or daughter, whether I'm treating ADHD or anxiety or depression. One of the things that I want people to understand is there is no best medication. There is no such thing. Part of what we do as physicians, as psychiatrists, is figure out what is going on with each of our patients and figure out based on their profile what makes sense. But despite all the marketing and the advertising that you see from drug companies touting their medication as perhaps being the best or perhaps being the most effective or the least side effects, the reality is, if we were to look at each of the categories we treat, most, if not all, the medications have the same potential benefit and the same potential side effects. And so a lot of times I want to kind of get that idea out of people's mind that there's some one medicine out there that is the best, because you're being marketed to. I get marketed to by drug companies and you know, through medical journals, through the commercials that you see, and they're all trying to tell us, hey, use our medication, use our medication, use our medication, it's the best one. I don't believe that's actually true. I believe that we need to be thoughtful about each individual person and think through what would make sense. But there's no one best medication. All the medications have the same potential benefit and the same potential side effects. However, in an individual person, that might not be the case. And so a lot of times, some people will preferentially respond better to one medicine versus the other, not because that medicine is actually better, but based on their brain chemistry and their body chemistry, that's actually what happens. But this is just an important idea because we're all being marketed out all the time about this stuff. So it's important to think clearly about this and to understand there is no such thing as the best medication.